At Queen Mary, we pride ourselves on engaging with our local communities and learning from them. So when Lullin emailed me from the Hackney Caribbean Elderly Organisation with some observations about her service users living with dementia and the experiences that they were having, I felt it was important that we develop a piece of research to address this.
Have any of your members been involved in research before?
Not as far as I know. It's our first venture into research. We do see ourselves as a community group that want to encourage people like you to come in and get feedback directly for our members. Talking with them, it kept coming up, there were a lot of pain.
I've been working with the Hackney Caribbean Elderly Organisation for 5 or 6 years now. And some years ago, Lullin said to me, I've been asking my members who are living with dementia how they are, and all of them are telling me about physical symptoms, and almost none of them are describing any memory problems. And I wonder whether this is something that should be looked into. So we looked at the GP records of over 1 million people from the inner East London boroughs to see what people were telling their GPs in the years before they got a dementia diagnosis. We found that people who went on to get a dementia diagnosis were more likely to complain of depression, anxiety, dizziness, balance difficulty, and constipation, amongst other symptoms. And we also found that people from certain ethnic groups were describing some of these symptoms more commonly than others.
People raise lots of questions about the suspicions they have about research. They raise questions about some of the fears they have for going to the doctors. They raise questions about how long it took to have a diagnosis. Dementia in our community is growing. I know that because from the number of referrals we get, and part of our work is about raising awareness, reducing stigma in the community about dementia.
One of the really important things is building a working relationship over a period of years. I think it's easy for researchers like me to come and visit as a one-off and be able to say that we've done it and pay lip service to working with the communities, but that's not the same as meeting up year after year, project after project, and in actually listening to you and designing new projects based on the experience of your members. So
the hope is that by making sure that GPs are aware that these symptoms other than memory problems might be signs of dementia, and that might be particularly important in people from certain ethnic groups, we can help GPs to get better at referring the right people early on to memory clinics. But we also hope that these findings will empower communities in East London to make sure they go to their GP and seek referral so that they can get the diagnosis that's really important.